Our family has a history of cancer. My dad had died of bladder cancer. My mother's a survivor of ovarian cancer. My brother died of colon cancer. My sister has had breast cancer.
He just had his physical from the doctor, and the doctor said, your labs are perfect.
I was perfectly healthy, and I had blood in my urine, and I went in to have a routine test, met a urologist, and then I found out that I had bladder cancer. And when they got ready to remove a bladder tumor, which is about a 30-minute surgery, they discovered that I had a cancerous kidney, and so I had the bladder tumor removed, and then 2 weeks later I had my kidney removed.
Well, it turns your world upside down. My father-in-law had died of bladder cancer.
Having two cancers diagnosed within 2 weeks of each other was a real shock.
Well, my mother had cancer, and she died of breast cancer when I was 15, so I'd been around it for about 4 years while she suffered. I was working at a machine shop as outside sales, divorced, single parent, raising 3 daughters. They went down and with a scope and checked everything, and he says, you got a growth on the back of your tongue we better take a look at. So they did a biopsy on it, and the next day they called me and said, it's cancerous, and you better come in.
I was just enjoying having time with my family, and I think I knew I had cancer when I went there, but losing your job, you lose your insurance, so it took me a while, a few months, to get someone to tell me I had cancer.
I put in 80, 90 hours, sometimes 100 hours a week, and when you can't do anything but go to the doctor, get radiated, come back home, and sit down in a chair because your feet are killing you and your hands are killing you, and wait for your kids to come home from school so they can put lotion on them. It disrupted things.
I think the Navigator can be life-changing in the life of a cancer patient and their family.
One night I was just feeling really down, and I just said, Lord, I really need somebody, and the next day I got a call from Cherie. She is the most awesome person I probably met through my cancer journey, and being a patient advocate, she did so many wonderful things to help me get through this.
It's a really rewarding thing to have that, and one of the resources I use to help to connect with people, in fact, I would say the most valuable resource would be the Navigator.
Just help them carry on and get them to the resources they need, whether it's the room where they have all the wigs in it, or if it's a support group. Getting people, connecting people, it's a big job. And for somebody like me who's not a good connector, it's really nice to have a Navigator who'll help me on that job if I need help.
It got to the point where financially it would have been really rough because I couldn't walk. My feet were cracking, bleeding, my hands were bleeding. So she says, well, I think we ought to get you on disability if we can do it. And she found a way to get me on disability for temporary disability.
I don't think I ever really was hopeless, but it was always nice to know that if I needed to talk to somebody or say a prayer, Cherie would do that with me, and it always gave me that little bit extra hope.
There were barriers, but I've always been able to overcome barriers. But when it gets to the point where you can't do anything, I mean, you can't do anything for 3 months, that's no fun. And she took care of everything that I needed taken care of. You know, I just went home and had my girls, and that was it. That was my life.
I had no computer, so she could look things up like finding me a place to live. But the best thing was knowing that every time I'd go to radiation that she would be there, and I'd get to say hi for a minute before I got to go in, and then I'd get to sit and talk to her afterwards.
Oh, I wouldn't have known what to do. Absolutely wouldn't have known anything. I just went in there and figured it was going to be a cakewalk, and it really wasn't.
I'm asking people to open their hearts and their wallets and give, because there is a lot of people out there in need.
If there's 40% of the people that aren't getting that kind of help, there's no way that their family could do it for them. No, you definitely need a second person if that's the case.
If you do find out you have cancer, ask for a patient navigator. The best present, I think, was my blessing from God was Cherie Dean, my patient navigator.